Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Cancer Buzz is in Washington, D.C. all this week, reporting from ACCC's 51st Annual Meeting and Cancer Center Business Summit, or AMCCCBS. As cancer leaders across the nation gather to discuss the latest in oncology business and policy and technology, we're here with Dr. Una Hopkins. She's the brand new president, as of today, of ACCC. Dr. Hopkins was voted into the role by her colleagues this morning at the meeting. She's the director for research and evidence-based practice at the Montefiore Medical Center in the Bronx, New York. Dr. Hopkins, it's wonderful to see you. Congratulations.
Thank you. Thank you, Summer.
How's the week been going?
It's exciting. It's exciting because we're all sharing the same problems and challenges and what we have to do and how we have to go forward and what's happening. And there's a lot happening.
You've been doing this a long time, volunteering for ACCC. What are some of the things that stand out to you from meetings like this that help you in your career?
I think it's great to network with colleagues that have the same challenges that you face in your everyday work life. I think the advocacy that ACCC brings to the table is amazing. I think the education and the fact that they are a how-to organization. So when you have a challenge or a problem, they figure out how to we solve it.
Let's talk about your presidential theme and what's coming up this year. I know you have a lot of plans and goals. We were talking about that before this started. Tell us about your theme and what you hope to accomplish.
So I hope to accomplish a theme that will combine the last three presidents, because I think workforce is going to maintain a challenge for us. And as Dr. Penberthy brought in technology and Dr. Ajay, additional technology, but AI pieces and understanding what the workforce needs are. And of course, Dr. Barrett, with her ability to bring health equity to everything that we do in cancer care, is really super important. So my theme is going to bring all three of those together, and hopefully we'll be designing oncology workforce for the cancer patients that we're going to treat. You heard yesterday about the 18 million survivors. So those are people that are surviving their first cancer and having a second or third. And so the volume of patients is going to increase, and so we need to be smarter with our workforce and use the best that we can that's out there. And we might need to change it up a little bit and design it differently.
How long have you been involved in ACCC? And I understand you've been in various leadership positions. You've been on the board a long time. What are some of those roles that you've taken on at ACCC before this big one, of course?
Well, ACCC is great about engaging you, right? And it's really important to be engaged, especially if you're going to end up on a board. You need to understand all the intricacies. The ACCC staff is just amazing in helping you get to where you need to go. One of the things that stands out most in my career at ACCC was the immuno-oncology. When there was a burst in immuno-oncology happening, they took a team of us, a physician, a pharmacist, and a nurse, and we went around to very rural places that didn't have even access to immuno-oncology. But then when their patients did get access to immuno-oncology, they didn't always know how to take care of those adverse events. And so that was really, really impressive that they were able to pull a team together and have us kind of take a show on the road. That was one of my most impressive pieces of that. I think that's when I actually got first onto the board. And then after that, it's an interesting perspective. So I served in the role of secretary and then president-elect and now president.
Dr. Hopkins, your experience being a member, how do you hope that you bring that to shape the role that you have now?
Well, that's the beauty of being a nurse, because nurses can do anything. We solve all problems.
That's right. That's absolutely right.
So I think by being that nurse and understanding and listening carefully, putting the perspective back out there, rephrasing things, reframing things, I think we will be able to carry through, and especially with the ACCC leadership, it's extraordinary.
That's fantastic. Thank you so much, Dr. Hopkins. Good luck. We look forward to hearing from you about your progress on this show this year.
Thank you very much.
For more on Dr. Hopkins' background, please check out the ACCC website. Keep an ear on this channel later today for more as we wrap up AMCCBS.
This show is a resource of the Association of Cancer Care Centers.